Narcissistic personality disorder, or NPD, is a recognized mental health condition. It's part of a group called Cluster B personality disorders, which also includes borderline, histrionic, and antisocial personality disorders. NPD is defined by a long-term pattern of grandiosity, a constant need for admiration, a lack of empathy. But here's the paradox. While someone with NPD may appear confident, even superior underneath, they often struggle with fragile self-esteem that's easily wounded. Think of it like a balloon. On the outside it looks big and inflated, but inside it's just air. A single pinprick, a criticism, rejection, or failure can deflate it instantly. Let's break down the hallmark traits which form a complex pattern. First is grandiosity. This isn't just confidence, it's an inflated sense of self-importance that leads them to exaggerate achievements and talents. For example, someone might say, "I basically ran that company," when in reality, they were a small part of the team. This is a reconstruction of reality to fit their need to feel superior. This grandiosity is fueled by a constant need for admiration. They require excessive praise to prop up their fragile self-esteem. They might dominate conversations, steering them back to their accomplishments, or become visibly upset if they aren't the center of attention. It's a dependency on external validation. Next is a powerful sense of entitlement. This is the unwavering expectation of favorable treatment, believing rules don't apply to them. This can be as blatant as expecting special treatment, like cutting lines or demanding favors, because in their mind their needs are simply more important. This entitlement often leads to interpersonal exploitation. They may view others as stepping stones to get what they want, often without guilt. They might take credit for a colleague's work or manipulate a friend for personal gain, believing their goals justify the means. At the core is a profound lack of empathy. They are unwilling or unable to recognize the feelings of others. If a friend loses a job, the narcissist might dismiss their pain by responding, "That's nothing, I've had worse," instead of showing care. They fail to provide genuine emotional support because they can't connect with another's pain. This results in an arrogant, superior attitude. But here's the paradox. Beneath this armor lies an incredibly fragile self-esteem. This is why they react so poorly to criticism. Any perceived slight can trigger a narcissistic injury, causing them to lash out in rage, sulk, or give the silent treatment as a form of punishment. It's important to remember, these traits need to be persistent and inflexible, causing real problems in life and relationships to qualify as NPD. It's a pervasive pattern that requires professional evaluation, not just a label for difficult behavior. Most people picture narcissism as loud and flashy, but there are actually different forms. Grandiose narcissism, the classic stereotype, bold, arrogant, attention-seeking. These are the people who love the spotlight. Vulnerable. Narcissism, more hidden. These individuals may appear shy or sensitive, but inside, they still crave admiration and feel easily threatened. Communal narcissism, those who see themselves as the most generous or the savior, always needing recognition for how much they give. Malignant narcissism, the most severe, combining traits of narcissism with antisocial behavior, aggression, and sometimes sadism. Understanding these types helps explain why not all narcissists look the same. Like most mental health conditions, NPD isn't caused by one single thing. It's usually a mix of genetics. Certain inherited traits may make someone more vulnerable. Childhood experiences, extremes in parenting can play a role. For example, excessive praise and overindulgence may create a fragile ego that depends on external validation. On the flip side, neglect, abuse, or constant criticism can also lead to a defensive overcompensation, where the child learns to mask insecurity with arrogance. Cultural and environmental factors. Living in an environment that overvalues achievement, image, or status can feed narcissistic traits. Neurobiology research shows differences in brain regions related to empathy and emotional regulation. So, narcissism isn't about someone just being born bad. It's a combination of nature, nurture, and environment. Living with, working with, or loving someone with NPD can be challenging. Common patterns include idealization and devaluation. At first, they may put you on a pedestal, showering you with praise, but over time this often shifts into criticism and devaluing. Control and manipulation. They might guilt trip, gaslight, or use silent treatment to maintain power. One-sided relationships. Conversations often revolve around them, their needs, their successes, their problems. On the other side, people with NPD often feel misunderstood and empty. Despite the mask of confidence, they may feel deeply insecure and fearful of rejection. This constant tug-of-war makes relationships unstable and draining for both sides. Before we talk about treatment, let's clear up some common myths. Myth 1. Everyone who's selfish is a narcissist. Not true. Selfishness is a behavior. NPD is a diagnosable disorder. Myth 2. All narcissists are abusers. While some may be harmful, not every person with NPD is abusive. Myth 3. Narcissists can't change. Change is hard, but with the right therapy and motivation, growth is possible. Myth 4. Narcissism is just confidence. Real confidence doesn't need to tear others down to feel strong. NPD can only be diagnosed by a licensed mental health professional. This is not an armchair diagnosis. The process involves structured interviews and validated questionnaires, exploring pervasive long-term patterns, not just one or two behaviors. A clinician looks for a consistent history of grandiosity, a need for admiration, and a lack of empathy that impairs functioning across work, family, and social life. This careful evaluation is crucial to distinguish NPD from other personality traits or even temporary states of arrogance. Treatment is challenging, but not impossible. The biggest barrier is that many people with NPD don't seek help voluntarily. Their core belief in their own superiority makes it difficult to admit their behavior is a problem. To them, the fault lies with others. Consequently, they often enter therapy only when facing a crisis, a relationship breakdown, a job ultimatum, or debilitating depression when their usual defenses fail. This external pressure becomes the catalyst for change. Several therapies can help. Cognitive behavioral therapy, CBT, focuses on identifying and challenging harmful thought patterns like entitlement or black and white thinking. Schema therapy goes deeper, addressing the deep-rooted, often childhood-based beliefs about self-worth and relationships that fuel the narcissistic defenses. Dialectical behavior therapy, DBT, is also effective, teaching crucial skills for emotional regulation, distress tolerance, and, importantly, building empathy by practicing perspective-taking. Each approach offers a different pathway towards self-awareness and change. There are no medications specifically for NPD, but antidepressants or anti-anxiety meds may be prescribed to manage co-occurring conditions like depression, which can make therapy more effective. The goal isn't to cure narcissism, but to help individuals build healthier, more authentic self-esteem from within. The aim is to improve empathy and develop stronger, more stable, and genuinely reciprocal relationships. So, what's the ultimate takeaway? It's crucial to remember that narcissistic personality disorder is far more than simple arrogance or selfishness. It's a deeply complex mental health condition, with roots woven from a delicate interplay of genetic predispositions, crucial early life experiences during upbringing, and the broader social environment. It's not a choice or a mere character flaw, but a persistent pattern of inner experience and behavior that causes significant distress and functional impairment for the individual. Think of the outward grandiosity as a carefully constructed mask. People with NPD project an image of unshakable confidence and superiority, but this is often a defense mechanism. Beneath that polished surface lies a fragile sense of self, deeply vulnerable to criticism. This internal world is frequently filled with profound insecurity, shame, and a fear of being seen as ordinary or flawed. Their self-worth depends on external validation, creating a constant, exhausting cycle of seeking admiration just to keep the mask from cracking. It's vital to draw a clear line here. Understanding the why behind NPD does not mean excusing harmful or manipulative behavior. Accountability is essential. However, armed with this understanding, we can shift our approach from judgment and stereotypes to empathy and clarity. This means recognizing the person's pain while still protecting our own well-being by setting firm boundaries. It's about replacing stigma with science and informed compassion, which ultimately benefits everyone involved in these challenging dynamics. Ultimately, our goal with mental health education isn't to apply labels, but to dismantle the stigma they carry. It's about breaking the chain of misunderstanding and fostering a community built on awareness and genuine compassion. If this exploration was valuable to you, please help us continue this mission. Hit that like button and subscribe to Diagnosis Unlocked. We'd especially love to know which mental health topic you'd like us to explore next in the comments. Your engagement helps create a more informed and empathetic world. Thanks for watching.